The doctor is in, and today's topic, genetic testing, specifically for cancer. In recent years, genetic testing to predict your cancer risk has become more available. And if you're in a high-risk family, you might want to consider genetic testing. So joining us once again is Dr. Scot Ackerman. He is one of the First Coast's leading oncologists. He is with us every week to discuss a variety of health topics. And today we're also joined by Julie Rhodenhizer. Thank you so much for being here. You are a breast cancer survivor, and we're going to hear your amazing story coming up in just a second. But Dr. Ackerman, let's go ahead and start with you, because let's talk about this genetic testing. How is it performed?
Well, genetic testing, let me clarify, isn't really a test for cancer. It's a test for a genetic defect that is linked to certain cancers. We've identified certain genetic defects that put one at a higher risk of developing certain kinds of cancers. Now, all cancers aren't related to a genetic defect. Most cancers, in fact, about 90%, are sporadic. They just happen because of environmental influences or bad luck. But about 10% of cancers are linked genetically. And we could do a test to see if there is a certain genetic defect that might put you at risk for these cancers. And we do a test either with a blood test, there's a blood vial here, or we could do a test with a swab of saliva. Both your blood and your saliva have your DNA in them. And so we could analyze that DNA and see if there's a genetic defect in that DNA that would put you at higher risk for certain cancers.
So what kinds of cancers are, what are you testing for then specifically?
Well, what we're testing for is this genetic defect related to cancer. So we haven't identified all the genetic defects that might be related to cancer, but there's certain ones we have identified. We've identified a certain genetic defect that's related to an increased risk of breast and ovarian cancer. Another genetic defect that's related to an increased risk of colon and uterine cancer. Another test related to pancreatic cancer, and another test related to the higher incidence of melanoma. The most common test that we see, or that we do, and the one that has a strongest relationship to an increased risk of cancer, is what we call the hereditary breast and ovarian cancer test, or the BRCA test you might have heard of, BRCA. It's a BRCA1 gene and a BRCA2 gene. Those two genetic defects are both related to a heightened risk of having either breast cancer or ovarian cancer.
Okay, and let's bring you, Julie, into the conversation and talk about your story as it involves genetic testing.
Okay, well, I was diagnosed with breast cancer, and through different circumstances, about 6 months later, I ended up, thankfully, with Dr. Ackerman in his office, who said to me, well, have you taken the breast cancer test, for genes to see if it's hereditary for you? Because I was young, it's usually less than the age of 50. And also a lot plays into it too if you have any family members. Well, I did not have any family members on either side who had had breast cancer, but I was definitely under the age of 50. So we had the test done, and it did come back positive, much to our surprise, because for me, I thought that it was mostly just hereditary. And so anyways, I had no one in the family that had breast cancer, but one thing that was never asked of me was if I had anyone in the family, any men who had prostate cancer. And also my father passed away not too long ago of pancreatic cancer. And didn't know it then, but those are all big things for the BRCA gene also.
So that's interesting. When it comes back as positive, what does that then mean? Because it sounds like the alert went out to all the family members that they might have this gene, but what does a positive test result mean?
Well, for Julie, she already was diagnosed with breast cancer.
Okay. So
the positive test in general means that you're at higher risk for developing breast cancer. She already did. But women have two breasts, and so she is at risk for developing a new cancer in the other breast by having this genetic defect. And also, as important, if not more important, is what does this mean to the rest of her family? Her brother, her children, and this gene she got from her parents, so perhaps her brother's a carrier as well. And there's a chance that her children, and she has 3 daughters, may have this gene also and be at higher risk for developing breast cancer.
So you can test children then to find out if they have the gene, is that right?
If Julie was negative, we're done.
Okay.
But since she's positive, now this triggers us to have a discussion with her about her children and perhaps do blood tests and genetic testing on her daughters.
And that means then you would probably change things in your life then, knowing that you have this gene, like a mastectomy, as we talked about in an earlier segment, or something of the sort, because you know that you're at a higher risk, like you were just saying. So what do you do with the information when you get the results? I know that you try to plan your life accordingly, but I mean, is this a case of just knowledge is power here? Just having this information at your fingertips, just so you know?
Well, again, yes, the short answer is yes, knowledge is power. But again, having this test positive doesn't mean you're going to get cancer. It doesn't mean you have cancer in your body or you're going to get it. It just means you're at higher risk. So we tested Julie's daughters, and turned out that she has 3 daughters. 2 were tested. One of them was negative. The other one is positive. How old is she?
She is 16.
She is 16.
So she knows, looking forward in her life, that she is at significant risk of developing breast cancer. So what does one do with that knowledge? You know, knowledge is power. So what's she going to do? She's going to make sure that she lives a lifestyle that's going to minimize her risk for developing breast cancer, or if she was to have breast cancer, she'd be diagnosed early. So, and when she gets to she'll do a monthly breast self-examination more fastidiously. When she gets to a certain age, she'll make sure she gets her mammogram, and she'll get her mammogram on an annual basis. And she may even consider having a mastectomy to prevent breast cancer from developing in that breast.
Wow. It's really just amazing when you know that this is even a possibility. Boy, you can plan your life just so accordingly to make sure that you can take every preventative precaution that you may need.
Well, the more people understand, they're better advocates for their own health. Julie's an advocate for her health.
Absolutely.
We talked about this. She really wanted to know, and now she has the knowledge that's going to help her and her family.
Well, Julie, thank you so much for coming on here and sharing your story with us. And then Dr. Ackerman, of course, always coming on every Friday and giving us really a good perspective on what we should be thinking about with our families and with ourselves too. So thank you for being here. And hey, listen, if you have any questions for Dr. Ackerman on this topic or any other health questions, you can always go to firstcoastoncology.com. Once you get there, you can confidentially submit your questions to Ask the Doctor.